Today I'd like to tell you a little bit about the West Clinic from the United States and what we're doing here in Singapore and all across Asia. The West Clinic is a large oncology, meaning cancer practice, in the United States, in the state of Tennessee. The West Clinic was founded more than 25 years ago by Dr. Bill West, an eminent medical oncologist who had trained at the National Cancer Institute in the United States and had the idea to bring academic care into the private practice setting.
And it started with the founding fathers of the clinic, and they emphasized that this is what they wanted to do for the patients, and everything is supposed to revolve around that. For instance, for that matter, the clinical trials, the purpose they brought it there was to make sure that patients get the latest drug treatment. And that's of course hard to do, as I said earlier, for private practitioners, but this was something they felt was very needed to do that.
Over the last 25 years, the West Clinic in the United States has grown through Dr. West's idea into a medical center with more than 40 physicians practicing in a variety of fields, but truly today still emphasizing cancer care. When a doctor says clinical care, it sounds like a very sterile and unfriendly word. What we mean to say is we want to be doctors. We want to be healers and take care of our patients. Even though we may have advanced scientific training, some of us have PhDs and have worked in laboratories, what's important to us today is a doctor-patient relationship to make sure that you and your family understand the diagnosis, how are we going to treat it, and how are we going to achieve a cure so that we can get you back to the rest of your life. The doctors at the West Clinic are all American board certified in oncology or oncology and hematology, disorders of the blood. By being American board certified, we can guarantee to our patients anywhere in the world that their doctors have had some of the most rigorous testing and evaluations available anywhere. Here in Singapore, it's incredibly important that we develop a cancer center, a private cancer center, with academic and intellectual values that provides cancer care that is both compassionate and cutting edge. We believe that by combining these elements, we can give patients across Asia the best possible care, and care that is identical to that is given in our offices across the United States.
I'd like to start off by saying that in Singapore too, we have all caring doctors. There are good doctors around too as well. But I think the difference lies largely with the system. A system that emphasizes the patient must come first, and everything revolves around that. So employing enough people, giving time for a doctor-patient relationship to develop, all that's very essential, I see. And if we are given multi-tasks to do and all that, then it's very difficult to develop that relationship. So I think that the difference between the American and let's say our Singapore system is, and don't get me wrong, Singapore system is slowly getting there because they realize there's a need to emphasize on those issues. But the difference lies, I think, in the system and the time given to the patient, that one-to-one care, and the support system that's available too as well. And that's key. When I was at the Mayo Clinic, for instance, too as well, when this person hits the front door, the reception person, the one who push you in the wheelchair and all, smiling, friendly, all the way, that gives a very good impression too as well. And I think we're slowly getting there, that kind of care. I don't like too much the word service because I think it starts from the heart, from within. That if that care is there, then the smile will follow, and that whole process will follow through. I think we're slowly getting there in Singapore too as well, but I think the one good advantage of the American system is that they have enough doctors, nurses, support systems to give that kind of care to the patient. There are about basically three types of oncologists, if you want to call them that way. It's related to the treatment, and certainly the treatment of cancers in general can be divided into three ways: surgery, radiation, and then there's chemotherapy or the drugs that we use to treat the patients with. I'll start with surgery first. Surgery is very easy to understand. If you have a tumor in your body, a surgeon must come in and remove that tumor from your body. So there are certain surgeons who are very trained or trained specifically in surgical oncology, dealing with tumors only, and they remove tumors from the body. An example would be a breast surgeon who does breast tumors. The second oncologist that comes to mind is radiation oncologists. Radiation oncologists are akin somewhat to surgeons. Their treatment is, of course, different. They use radiation therapy. But the radiation therapy usually tends to be very focused, like a big beam of light focused in one area. So in certain things like the surgical oncologist it cannot remove because of the location of the tumor, such as in the brain, a very vital organ is close by. Then the radiation oncologist will step in, perhaps, to try to radiate that tumor, as an example. Of course, you have a bigger role than that. A medical oncologist is what I do, and basically we give chemotherapy to the patients. Certain tumors respond beautifully to just chemotherapy alone, and you don't need the radiation or the surgeon, a radiation oncologist or the surgeon to assist. But certainly, as a multidisciplinary unit, sometimes some tumors like breast cancer requires all three to come together, and the surgeon removes the tumor, followed by the radiation oncologist to radiate, potentially eradicating any tumor left behind, and then the chemotherapy comes into the picture by giving chemotherapy to wipe out any tumor that could have gone beyond the local area of treatment. So that would be an example of the three types of oncologists in this area.